Hello, I'm Kyle Wallace, and my son Eli has FOP. I'm also a scientist, and in 2016, I joined the research committee of the IFOPA. From that vantage point, I have seen directly how innovative the IFOPA has been as it seeks out and funds the most advanced and promising FOP research. Let me tell you a little bit about that innovation. The discovery of the FOP gene in 2006 was a direct result of the IFOPA funding the basic science that is the backbone of all therapeutic development. That momentous discovery at UPenn's Center for Research in FOP and Related Disorders gave researchers a target. Since then, there have been 9 different drugs in clinical trials designed to take aim at that target, and a 10th is coming. 5 years ago, we took a bold step and launched the In Pursuit of a Cure campaign to fund the first research grants to determine whether gene therapy could be an answer for FOP. Those grants enabled the team at UMass to develop and test a gene therapy in FOP mice and prove that this therapy can work. Now we need a commercial partner to take those findings and work towards developing human clinical trials. The success of the UMass team has inspired other scientists to study additional types of gene therapy. Their findings, among others, were shared at the IFOPA's Drug Development Forum this past June. The DDF is another example of the IFOPA's innovation. It is the only research meeting in the world that brings together clinician scientists, academic researchers, and pharmaceutical companies to share the latest scientific and clinical research in FOP. This meeting has become an invaluable forum that fosters collaboration and advances research. We also heard updates on a clinical trial that the FOP community played a major role in making possible, a trial called Stop FOP. This trial, which tests whether a drug that was effective in mice can stop bone growth in people with FOP, was nearly derailed because of the COVID-19 pandemic. Recruitment for the trial had to be put on hold, which meant the team's funding would end before the trial could be finished. The IFOPA recognized the importance of this trial and stepped in to provide the funding needed to keep the principal investigator in place for the duration of the trial. That support energized other funders, from philanthropists to family members, to step in and keep the trial going. The goal of any drug trial for FOP is to determine whether the medication successfully stops or prevents new bone formation. But current methods for measuring bone growth are expensive and time-consuming. So another way the IFOPA is supporting clinical trials is by searching for new ways to measure bone growth that could be more efficient, less invasive, and could more quickly determine whether a drug is working. But stopping bone growth is not the end goal for the IFOPA. With their support, researchers are looking ahead to determine, once a treatment is approved, whether it would be possible to perform surgery to remove the extra bone that is already formed. And then, can muscle tissue regenerate where the bone once was, so that people with FOP can regain the use of limbs that have been immobilized? One of the IFOPA's Act for FOP grant recipients is researching that very question. The fact that we're at a place where we can even ask these questions is all thanks to the support from donors like you, who have made the IFOPA one of the largest private funders of FOP research in the world. As a parent of a son living with FOP and a scientist, I thank you from the bottom of my heart. The IFOPA is committed to funding research until we find multiple treatments and ultimately a cure for FOP. That is why 100% of the funds raised through this day of giving will directly fund mission-critical research. Join us today to invest in a more hopeful tomorrow. To learn more, visit ifopa.org/updates.